Nifa in the time of COVID. A boy infected with Nifa virus has died in Kerala, a state already hit badly by COVID 19. How do the two viruses compare in transmissibility and fatality? How is Kerala addressing the twin concerns? A 12-year-old boy infected with Nifa virus died in a private hospital in Kochigod on Sunday morning. The boy showed symptoms of encephalitis and myocarditis, inflammation of the brain and heart muscles respectively. The re-emergence of the Nifa virus in Kerala poses a fresh risk in the state that is already struggling with the COVID-19 pandemic, contributing about 60% of all new cases in the country these days. However, this is not the first time that Nifa virus has been detected in Kerala or elsewhere in India, and previous outbreaks have remained largely localized and have been contained relatively quickly. What is Nipah virus? The first outbreak of the Nipah virus among humans were reported from Malaysia in 1998 and Singapore in 1999. The virus takes its name from the village in Malaysia where the person in whom the virus was first isolated died of the disease. Since it was first identified in the 1998-99, there have been multiple outbreaks of the Nifa virus, all of them in South and Southeast Asian nations. In Bangladesh, there have been at least 10 outbreaks since 2001. In India, West Bengal had been an outbreak in 2001 and 2017, while Kerala had reported several cases in 2018. How does it spread? In a zoonotic virus, meaning that it has transmitted from animals to human beings, the transmission happens mainly through consumption of contaminated food, but human to human transmission is also considered possible. The animal host reservoir for this virus is known to be the fruit bat, commonly known as flying fox. Fruit bats are also known to transmit this virus to other animals like pigs and also dogs, cats, goats, horses, and sheep. Humans get infected mainly through direct contact with these animals or through consumption of food contaminated by saliva or urine of these infected animals. Person to person transmission is not fully established. But a recent study published by two Bangladeshi researchers in March this year said that previous outbreaks in Bangladesh, the Philippines, and India suggested that respiratory droplets of an infected person can transmit the virus. During previous outbreaks, people in close contact with the infected person, mainly hospital staff and caregivers, have contracted the disease. Does it spread as fast as COVID 19? The Nifa virus is known to spread far more slowly than the SARS-CoV-2. However, it is its ability to kill that is the biggest concern. During the first outbreak in Siliguri, 45 of the 66 people confirmed to have been infected died. That is a mortality rate of 68%. In the next outbreak in Nadia district of West Bengal in 2007, all the 5 infected people died. During the most recent outbreak in Kerala in 2018, 17 of the 18 patients confirmed to have been infected died. In 2019, one case of Nifa virus infection was detected in Ernakulam, but prompt response restricted any further spread. The infected person survived. In the Malaysian outbreak in 1999, a total of 265 people have been found infected, of whom 105 had died according to a study. Nifa virus past outbreaks and future containment by researchers from Cochin University of Science and Technology published in the April 2020 issue of the journal Viruses. In comparison, the mortality rate of COVID-19 epidemic is expected to be around 1%. How well has Kerala handled previous Nifa virus outbreak? In 2018, Kerala had no past experience of handling a disease with such a high fatality rate. The state followed the protocol for Ebola virus disease, which had been reported mainly in sub-Saharan Africa. At one point in June 2018, around 3,000 people were under quarantine in Kochikode and nearby Malappuram districts. All the persons who had direct or indirect contact with the suspected Nifa cases were thus put under observation. When the state reported Nifa again in 2019, the health department already had a protocol in place to handle the situation. In 2019, only one case was reported in Ernakulam district. In 2020, the state did not report any Nifa case, but the protocol was updated and sent across the system. How is Kerala handling the fresh Nifa concerns alongside COVID-19? The Nifa virus victim hailed from the village of Chatmangalam, 50 km from Changarroth, 3 wards under Chatmangalam Panchayat in Kochikode, where the victim lived, were completely closed down on Sunday morning. Micro-level restrictions have gone into effect. Movement to and from these 3 wards have been banned. Police have put up barricades and checkpoints at all locations leading to the village of the victim. With COVID-19 protocols already in place, there is heightened awareness about transmission of viral diseases. The ongoing use of PPE kits, gloves and masks, especially by healthcare workers and hospital staff, is likely to offer reduced opportunity for the transmission of the Nipah virus. Should other states worry about Nipah spreading? Thus far, all outbreaks of the Nipah virus have been localized and contained quickly, at least in comparison to the ongoing COVID-19 pandemic. The first outbreak in Malaysia started in September 1998. Although it was only by March next year that scientists were able to confirm that this was a new virus they were dealing with. The outbreak was contained in May. In Bangladesh, where Nipah outbreaks have been most recurrent, transmissions have stopped after a couple of months. One of the main reasons for a relatively quick end to an outbreak is the fact that Nipah virus is far less infective than SARS-CoV-2. For example, human-to-human transmission is not as easy or as fast as seen in the case of SARS-CoV-2. A study by Bangladeshi researchers P. Devnath of Noakhali Science and Technology University and HMAA Masood of Chittagong University published this year noted that the reproductive number in the previous outbreaks of Nipah virus was about 0.48. The R value is a measure of how quickly the virus spreads in the population. A value less than 1 means less than 1 person is being infected an already infected person. In such a scenario, the outbreak is expected to diminish relatively quickly. The study also notes that Nipah outbreaks have happened mainly in sparsely populated villages. The potential of the virus to spread to many individuals has been low. Further, the very high death rate also contributes to low transmission. Thank you.